So I wanted everyone to understand how you're a serious academician, if that's the word, academic advisor and lecturer and researcher, not to mention clinician, and with a very serious mindset about it all, but a deeper dive than most people take. Because I felt like, for one, that information isn't out there widely enough. We know that to begin with. And secondly, because we want to talk about a pillow. And I didn't want to start with that because people may go, oh, okay, great, they're selling a pillow. No, that's not what we're talking about here. We're not talking about we're going to give you a comfy pillow and we're just trying to sell thousands of them. No. But there are therapies that are novel approaches. You've developed one that I think is fantastic, to solving one of these problems anyway, or making this problem better, because it does take a lot of iterations to get to the right, I wouldn't even just say diagnosis, but not diagnoses, like several contributors to this problem of decreased oxygen at night, poor sleep at night, etc. So tell us a little bit about the pillow. I want the story too. I love the story of how it's developed and where it's being manufactured and all of that. And when is it available? Because I want a bunch of them, because I want a bunch of them for my friends and family as well as my patients. So let's talk about the pillow.
So, really how it came about, and just the back part of it, is the biggest failure on CPAP and oral appliances position. And if you're on your back, right, all bets off. Your tongue falls back, gravity takes over, your soft palate drops. So my friend is an ENT, one of my very, very good friends, and we would treat a lot of patients together. And he would always tell people to put a tennis ball in their t-shirt, which I don't love that, or use one of these things on Amazon that prevent you from rolling on your back. And, the tennis ball kind of got me, because I'm like, Jay, I don't, like, that's weird to me, because I feel like if someone rolls on a tennis ball, and you could probably comment to this, I feel like it would break their sleep cycle. I almost feel like it would consciously or subconsciously wake them up.
Yeah, I would think too.
So, what happened was I was sitting with him, just like we're talking, and I literally was like, well, what about a pillow? And he's like, well, what would you do? And I took a piece of paper and I drew the pillow, like literally drew it on a piece of paper. And what happened was, my friend from the Navy does 3D printing. And I'm like, could you print me like a miniature version of this? He's like, sure. Prints me a small version. Then we print this monstrous piece of plastic. I cut a piece of fabric over it. I find a seamstress and I learn how to make a pillow. Then I find a pillow factory in South Carolina. I go down there for a week. I sit with them the whole time, and I learn how to make pillows. And that's kind of how our pillow launched. And we ended up like testing it. You have our first version. And then I got introduced to someone that was with Tuft and Needle, a pillow and mattress startup. He's an Air Force veteran. I'm a Navy veteran. He actually became our CEO, and we hired an industrial designer. We redesigned our pillow. We're manufacturing it here in the US. I was just in Las Vegas last week, and we're launching April 15th. And I actually have the pillow here.
Yeah.
It's in a bag, and it comes roll packed. So it fits in this bag a lot different, but it's so different than the one that you have.
Okay.
I'll put the laptop back so you could see it. And the head part's really soft, and between the head part and the back part is a chamber. So the premise was to create a fulcrum, so when your head goes down, the back part pops up. And we've sleep tested people without and with the pillow and gotten great results. And the material in there now is responsive foam and like a fiber. And it's like memory foam pillows. Your head goes down and you stay down. Ours, you go down and you're like floating. It is the most amazing thing I've ever slept on.
Wow. I cannot wait to try it. That's fantastic. Yeah. I love the one that I have, but sounds like this is new and improved.
First of all, the one you have I made it, and I don't know anything about pillows except trying to figure out what to do. Now we have like a team of people that really understand pillows, understand like the fill in them and the performance and the responsiveness. I'm so happy I got it back, because I was like, I'm taking one with me from the factory, and we're literally, launching April 15th. And it's fun because it's working with people like you, our physicians, our pulmonologists, our ENTs, our dentists, our chiropractors, our physical therapists, just to kind of get it out to patients and get feedback. I don't want to be a pillow company, Gina. I want to be what Apple is. I want to be a solution company. It's the same for our mouthpiece.
Mm-hmm. That's right. And Apple, as an example, has many different products to solve solutions. And so you may end up having several things. Well, obviously you're working on this problem with creating solutions in a variety of ways, with your research work, with your appliance work that isn't the long-term solution for a lot of people, and your education piece. Just you're working on it from several angles. So good for you. Keep up the great work. And also, let us know when the pillows are available, because I want to, help you launch that. Because I do know I have a waiting list of patients that want it, because I've been talking about it. But tell us, did you change the name, or tell me what it's called?
So we're in the middle of rebranding right now.
Okay.
I have a meeting Friday. I'm lecturing with Dr. Gelb in New Orleans, and I know we have a meeting with our kind of rebranding team Friday. And it was great. I was just in Detroit. We did like a photo shoot for the new pillow, and Las Vegas. Our partners are great. They love startups. And for me, I love this. I love the product because everyone's already sleeping on a pillow.
Yes.
Right. So everyone doesn't have the luxury to go to the doctor and the dentist. It's like, we have a pillow. And I had a story last week. I have this fit woman that lives in New York City. She's like one of our biggest supporters of our mouthpiece, because she was so vocal of being like, oh my God, my husband's ready to divorce me. And you would look at her and you'd be like, wait, she's the one snoring? I would have pictured that her husband to be the one snoring, because she's so fit. But she has upper airway resistance syndrome, had poor orthodontics, she's tongue-tied, everything. So last week she texted me, she's like, all right, seriously, my husband's ready to kill me. I lost my mouthpiece and now I'm snoring again. So she had the first version of the pillow. So her husband's like, listen, go try the stupid pillow. Maybe the pillow will work. Who knows? So she comes in and she's like, all right, seriously, I've slept on the pillow for 3 nights and I didn't snore at all. Like, I can't even believe the pillow works.
Wow. Good job. Excellent. That's a great story. Such a great story.
Testimonial. And it's interesting. Like, there was a company years ago that you and I would remember this. I don't know if some of your younger viewers might, but BASF, the audio tape company.
Yes.
Their message was something like, we don't make new products. We just make existing products better. Like, that's what we are, right? Like, I didn't invent a pillow. I'm like, I just made a pillow better.
Yes. Yes, you did. Absolutely. And in fact, I was skeptical. The first time you showed me the pillow, I'm like, okay, I'll lay on it, whatever. I have a pillow I like. Thank you. I didn't want to leave without it, really. And of course, that was just a little trial. I didn't even try it all night that first time. But then when I did, I was convinced too. And that, as I said, is the first version. You've made it even better. But
oh my God. Yesterday I went to film, because when it comes roll pack, you have to fluff the pillow. So I'm like, all right, we have to video me fluffing the pillow.
Yeah.
So all right, fine. And she didn't like the first version of the pillow. And I understand why. The head part was a little bit too propped up. And now we flattened it out. And she's a super tough critic. And I'm like, all right, do me a favor, lay on this one. And she was like, oh my God, this thing's amazing. And I'm like, all right, now I know at least we're good. If she gave us the stamp of approval, then I'm like, I'm good to go.
That's great. She gave you the stamp of approval, and so did the very fit woman who was snoring. So you've got a lot of great People giving you great responses already. But I also think it's so important for us to pause again and talk about the very fit woman who had obviously a sleep problem. It was disturbing her sleep and her husband's sleep. I was just telling a group of people I was talking to earlier today on an educational event that we were having, that regardless of where you are, if you're just hearing about an airway disorder that could be affecting people, in fact, is epidemic. It is affecting millions of people that have no idea. That's why they can't concentrate, or that's why their child can't concentrate in school, or a whole host of problems. At least open your mind to looking into it, to getting an initial evaluation, because it affects people of all fitness levels, of all body sizes, every gender, and every age. Everyone could possibly have this problem. And if you don't, wonderful. But if you do, you need to know, and you need to go to an expert like you, Dr. Martin, or we can give them resources to find solutions, because it's not a pill for diagnosis. That's not what we're talking about here. It's not a procedure. Like this one procedure is the do all, be all, end all answer. It's working with a healthcare provider such as yourself that's going to consider all options. But there are answers out there. That's the good news. There are great answers.
Yeah. I mean, but it's interesting. Every time I walk into a lecture room, so I ask this question, and I ask it very differently if I'm chair side, but I always walk into a large room and I'm like, all right, who in the audience snores? And I'm like, when no one raises their hand, I'm like, all right, you're all full of crap, because 70% of the population snore. And Gelb and I always say, we're like, men are in denial and women speak in code. So it's like, it's obviously a huge problem. Yeah. But if I'm chair side and I'm meeting a new patient, I never ask someone, do you snore? I said, are you aware that you snore? Very different question.
That's a great question. That's a great question. And it makes me think of, Laura Hooper's on our team and does a lot of the patient education. And so maybe we should start asking that question. Are you aware that you snore? Or let's rule it in or out. What she does a lot of times, though, in a similar fashion, is she says, we don't know if you snore or you don't. So I want you to set your phone up in this way, and I want you to turn it on video. I want you to videotape yourself at night. Let's see what it shows us the next morning. And almost every time people snore. I won't say every time, but almost every time they're shocked, and we have documentation that they're snoring. Yeah.
Yeah, I mean, I definitely was snoring bad 2 years ago until I did my own ortho, got a mouthpiece, slept on our pillow. You have to hack your sleep. I always say snoring and sleep apnea, it's just like diabetes, incurable disease. But what do you do with diabetes? You mitigate symptoms. Well, with this problem, you do the same thing, unless it's a child. If it's a kid, you could fix that. But in an adult, it's not that you're going to cure it. There's companies out there like, oh, we're going to cure your sleep apnea snoring. I wouldn't say you're curing it. I think you're just managing it and mitigating the symptoms.
Yes, I agree with you. And we're learning so much more as time goes on. Who knows what we'll have to offer in the future? It's so much better today than it was even last year or the year before in terms of options, solutions that are potential options. And yeah, absolutely. I want those that are listening that are parents, grandparents, aunts, uncles, have children in their life that they know and love, to think about that and to be sure and share this video, because if we can, what is it, fixed by 6, or there's a lot of different slogans out there, but identify as early as possible. And our friends like Dr. Siegel and Lisa Palladino and others are talking assessment at newborn to make sure that everything develops properly. That's why a lot of newborns aren't breastfeeding well or have trouble. It's not the mother a lot of times, it's the baby that sexual issues. So this is just a widespread problem for all ages. We've said that several times, several ways, but you're right. We've got to especially target the children to fix this problem.
I mean, that's such a sweet spot for me, because especially I didn't treat kids in my restorative practice. And then when I got to ortho, and then I was trained on Airway by Barry and Victor and Tufts and all these great people, that I was like, wait, there's 6 million kids a year diagnosed with ADD and ADHD. I would tell you that a lot of those kids, they're put on stimulants. I mean, multiple stimulants, amphetamines. you know, it's a big problem. Or even, you know, the other thing that I talk to speech and language pathologists about, I'm like, first of all, a lot of their speech delays could be that they're tongue-tied. The other thing is, if you see a 10-year-old and they look like they're 5, they probably have an airway problem, right? Instead of sending them to get, you know, growth hormone shots, they're not producing growth hormone. They're not getting into that part of the sleep cycle to produce growth hormone. I think that's what we miss also, especially in ortho. I see a lot of that, and I kind of convey that to the residents. I'm like, you guys are seeing these kids here every day. Right? Like, we got to do better than what we've done.
Yes. Yes, absolutely. I love what you're doing. I love your message. I love that you're out there all over the place. It's kind of like, where in the world is Dr. Martin?
That's what, yeah, trust me. Got it.
But you're covering a lot of territory, sharing a great message and driving the research forward. So thank you so much for what you do. And keep us posted on the pillow, because we're very excited to get our first batch, if you will, first bulk. Yeah, I can't wait.
Of course.
Anything else you want our listeners to know?
I'm so appreciative to, 1, do what I do, 2, work with incredible people like you, and, you know, give us a platform to just kind of share our message. You know, I was on today with a dental lab, and, you know, I said, I was like, I gave up a really good salary to go back to school to kind of, you know, help people. And for me, I was able to touch 1,200 people in practice. Now, you know, with our pillow, I could touch 200 million people. Like, that's freaking exciting.
Yes. Isn't it exciting to be alive during this time? It is. You're younger than I am, but I, like you, like, I went back for my doctorate degree, stopped, and I cut way back on my clinical practice to get my doctorate degree, to figure out, like, okay, maybe you can call it a midlife crisis, even though I was in my 50s when I went back to school, my 60s now. But it's like figuring out what is my impact that I want to leave in this world, and something bigger. And I do love one-on-one. It's my favorite thing to do with patients. But like you say, you get to a point where you're like, wow, there's not enough people out there doing one-on-ones in a high quality, comprehensive way. And so we want to teach others to do that, so that
it's, I mean, even the people that I've referred to you, because you've helped, you know, Dr. Gelb and I, right? Like, even on peptides, you know, that's a hot topic now. One of my partners is involved in, you know, IV drip bars, and they're doing peptides. And I'm trying to convey to them, I'm like, here's the deal. Like, you can't just be like, all right, I'm going to go on the internet and buy peptides. Like, you don't know, you know, it's like using a supplement. And I learned a lot from you on especially the supplements that you've given me, right? Like vitamin D, other things, because I'm like, well, I could go over the counter and just get it, but I don't know where I'm deficient. You know, I always say, like, you're the 1%, right? Like, how do we get everyone access to your care? And I think that's really, really important for people to understand that. And I think for what we're doing, it's access to care.
yes, it is access to care. You're right. And I probably, like you, I'm not sure what your practice was like, but I practiced for many years in a traditional healthcare model. And it truly was, we've got to name what we're seeing. So we've got to call it a diagnosis and give it a code, and then pick from a list of procedures or pills to treat it. And now we're over here trying to really identify early before that problem occurs. And even if it has occurred, reverse and stabilize that problem and create health in the individual. It's a very different type of way to even approach the individual. And it's the only way we're going to see the heart attack rate drop from the #1 killer, or strokes, you know, occurring at the rate of hundreds of thousands per year, is to change the way really that we're practicing. And as you said, most importantly, making it accessible to everyone, or to people in a larger way. So we're starting to try to spread the word, both you and I, both to the public and to our healthcare colleagues, to try to make change where we can. Great conversation. Thank you so much for sharing your time with us today and your expertise. And we'll get back on again as late breaking research and findings become available from Dr. Martin. And we'll have you back on again, but thank you so much.
All right. Thanks so much, Doc.
You're welcome. Take care. Bye.
Bye now.